Hey, what's up guys? Coach Little here. Wanted to talk about ACL injuries, okay? So ACL is the most common ligament that gets torn in athletes and specifically younger athletes. So 70% of these injuries are non-contact. So this happens when we are jumping and landing, or when we are sprinting and stopping, or changing direction rapidly, okay? So two things are happening here. When we're landing or cutting in any certain direction, we see that knee cave in, okay? So what that does is my knee caves in, hip caves in, and ankle will cave in. So then it's putting my knee a little bit flexed forward and then closer to my midline than my ankle. So what that's doing is it's pushing my tibia forward, and then my femur and tibia are compressing a lot. And then in our quad dominant athletes, right, our hamstrings aren't strong enough to pull that tibia back. So then all of that force is going right onto our ACL, and it can't handle that. So how we can prevent this is there's three big ways that we can train our hamstrings. So we can train our hamstrings as knee flexors, okay, where we are fixed at our hips. So that would be like a hamstring curl. We're really focusing on lengthening that muscle and strengthening it in its longest and shortest position. The next way would be as a hip extensor, where our knees are fixed. So we do a ton of this with our athletes, like an RDL or an A-reach. Again, we're saying find your hamstrings, and we're saying find a nice big stretch. So we're really stretching out that hamstring again, strengthening it in its full range of motion, so that when we do land hard, or that when we do cut hard or stop suddenly, our hamstring is taking a lot of that force away from our ACL, and it's preventing further injuries. So that is why we do those exercises.